as an artist, I combine running and photography to explore the world around me. In the words of the Navajo, running is about pushing yourself physically and mentally to find out more about what lives inside you. Running is a prayer, a form of moving meditation. It is a way to celebrate life. For me, the manifestation of my art through running is that celebration. And I want to share with you all today the hope that I see when I lace up my shoes and embark on the road or a trail, often in the early hours of the morning. I woke up 2 years ago to find a few inches of snow on the ground. It was 5 a.m., and there were no cars out dissecting the clean white powder on the streets, or shoes' footprints meandering along the sidewalks of the road. It was magical, and the cold made it even more exciting as my breath floated towards the sky. You may remember that scene in Bambi when they're loping around in the clouds. Running up the arching ramp of the Big Four Bridge covered in snow as flakes continued to fall felt like that. For many people, running in the cold is a non-starter, let alone in the snow. But these runs, and many like them, have led to a lot of good conversations. They often start with, "You must be crazy," and then lead to an expanded understanding of how you can view activities as an exploration rather than a duty or a chore. I see running and my art as both rooted in tenacity, curiosity, and exploration. You have to be agile in how you approach things, willing to change course and improvise, and must have trust in the process, even when the outcome is unknown. Curiosity also allows you to see details like dew on a spiderweb in southern Indiana or on the blades of grass in New Orleans Crescent Park. The interplay of light and shape during sunrise at the Big Four Bridge and the reflections on the Ohio River. The graffiti on an abandoned building in Smoketown, or the hand-painted fishing boats on the coast of Senegal, West Africa, and the outline of the Renaissance monument overlooking Dakar. You see, I explore the world through panoramic landscapes and mirrored patterns, because this, for me, is where 1 + 1 = 3. And I'd like to hear from you all. I'd like to know if you have had a perspective-changing experience with art. Let's see a raise of hands if a story or a poem or a song, maybe a meal, has impacted the way that you interact with and understand the world around you. Look around. I think that we can all agree that the power of artists to create opportunities for expanded understanding is immense, because I believe that artists are a catalytic force who make new options visible. And this is the mantra we believe at xLab, the artist innovation company I co-founded with Theo and our partners Chris and Ayelet over 4 years ago. You see, we believe that artists are an untapped resource for moving a community through radical healing toward hope. Hope as a way to drive equitable policy changes. And through our partnership with our nonprofit arm for training artists, Creative Agents of Change Foundation, we've embarked to validate that belief. Over the past 4 years, we've prototyped artist innovation projects with corporations like GE's First Build and Humana, and nonprofits including Youth Build Louisville. We've seen how artistic practices can expand capacity within organizations, within the way that people think about how they use their equipment and how they approach situations, and within the workforce. Our latest initiative, Project Heal, is a 3-year process that engages artists across the community's 5 social networks, where people live, work, worship, learn, and play. We've seen that artists can help us as we work toward health equity in a community, helping people achieve the highest attainable level of health that they can, that allows them to do the things that they want to do on a daily basis. and by engaging and training artists to understand health equity and qualitative data collection, we're working to do that. So while quantitative data may tell us the what in terms of health barriers or health and disease issues, we need the qualitative data that tells us why to be able to get at the root causes. The Stanford Social Innovation Review recently released an article about the need-demand fallacy. And they talk about how there may be a lot of need for a program, but if there's not demand for it, it doesn't really matter. So if you think about diabetes prevention, for example, there are 86 million Americans with prediabetes in the US, except only 20,000 or so are enrolled in DPP programs. That's a really big discrepancy between need and demand. So as we think about how context determines what we look to tackle, quantitative data may say that diabetes is what people should focus on, but engaging qualitative data may show that people are more worried about the safety of their children or the 45-minute bus ride that they have to take to get to the grocery store because they live in a food desert. At Ideas, we believe in both health and cultural equity. We know that artists of color are underrepresented and underfunded. So as an artist that is white and working in many communities of color, it is part of my responsibility to leverage the white unearned privilege that I have to bring resources to bear as we work with communities to improve both health and cultural equity moving forward. The community that we live in is called Smoketown. It's the oldest African American community in the city of Louisville, with over 150 years of rich history and culture, and a growing number of partners and stakeholders within the community coming together to create positive change. At the same time, Smoketown is located 50 feet across the street from the highest concentration of medical and health-related services in the state of Kentucky. Yet, our residents in Smoketown have a 9-year difference in life expectancy than the Louisville average. There are two projects as part of Project HEAL that I'm going to talk about today. The first is One Poem at a Time. And this is an initiative developed by artist and Ideas xLab team member Hannah Drake that we launched last Saturday, April 1st, 2017. And through a year of community discovery and arts and culture interventions, we came to understand how negative and predatory advertising and messages in the community are a social toxin. So the same way that lead puts environmental toxins into an environment, so do negative messaging. You may have seen some of these signs before. Cash for your diabetes strips. This is a multi-million-dollar black market. Cash for your house. Billboards that talk about gun shows, cheap lawyers, abortions. All of these things continue to reinforce a feeling within the community and impact the perception of the community from those outside it that come to visit or drive through. So as part of One Poem at a Time, we've replaced over 10 billboards in the Smoketown neighborhood with positive images and poetry we created with the Smoketown community. We thrive when we work together. Lifelong friendships begin in Smoketown. This one says, healing begins one step at a time, and this photo is from the Smoketown Peace Walk that happened last summer. We had a series of shootings all within 1 week, and hundreds of Smoketown residents and community members came together to support each other. So the man in the middle of this image is Henry Booker, and he is the grandfather of a 14-year-old named Trevante. His friends and family called him Fat Daddy, and he was one of the young men that we lost that week. Anything is possible with hope. This is a group of young men from the community, and the image on the right is from the One Poem at a Time launch last week. Rebuilding, but never forgetting our history. Don't count the days, make the days count. This is another one of the photos from my runs in Smoketown, and this is the Smoketown Unity Monument, which sits a few blocks from where we live. It represents the history and heritage of boxing in the neighborhood. This is where Ali first learned to train, and symbolizes a love for the people in our community. As part of the launch of One Poem at a Time, the goal was to bring together community residents and stakeholders with policymakers, using arts and culture as a language to engage in a conversation around policy change. How do we limit or mitigate these negative and predatory advertisements and billboards from being present in our neighborhood? That is what we're working on with One Poem at a Time. Another project that's happening right now is called the Smoketown Lifeline Project, and it was created by Project Heal artist Andrew Cousin, a sculptor who came to see that his artistic practice could be leveraged to engage community members in Smoketown in conversations around trauma while visualizing its multidimensional impact. Each rod that you see represents a life in Smoketown. 1.25 inches equals a year, and every bend is a place where an instance of trauma occurred. Andrew did a few months of community discovery and research, and then stood outside on a corner in Smoketown for a full month, talking to residents, listening to their stories, and hearing the details of where trauma had occurred. The different bands correlate to different types of adverse experiences that the community has gone through. And you can see patterns where one type of trauma triggered another. Smoketown Lifeline also shows ACEs, the adverse childhood experiences that happen before age 18 and can have a lasting negative impact on health. So as we think back to the 9-year deficit in life expectancy, Smoketown Lifeline helps to visualize that and give us a platform for how to have a conversation about moving forward, identifying the disparities, and creating an action for change. Andrew is one of the examples of how an artist's practice was transformed by participating in Project Heal through the training and through engaging community members. Hearing their stories and being out immersed in the community and doing that research fundamentally changed how he thought about his practice and how he is training the next generation of artists in the US. And it's these type of projects, One Poem at a Time and the Smoketown Lifeline Project and others as part of Project Heal, that we're seeking to evaluate over the next 3 years through the Center for Art and Health Innovation, which is our partnership with the Commonwealth Institute of Kentucky at the University of Louisville. And we're doing that through a measure we're calling cultural ROI. So we're not talking about how many paintings an artist sells or how many people attend a performance. We're talking about looking at how, when you train and invest artists and you implement a multi-year arts and culture framework, how these things can impact social connection, isolation, and expanded critical consciousness, all with an eye towards policy change. My challenge for the artists in the room is to think about how your artistic practice could be deployed and expanded as a way to help communities move toward improved health and well-being. And for our partners and friends in the civic, corporate, and governmental sectors, I challenge you to think about how these types of arts and culture strategies could be leveraged to expand your ability to help our cities move toward building a culture of health that's accessible to all. Thank you.